I've been chosen by God, chosen by God, chosen to be nurses, to love and serve. We have been chosen.
Eibura ry'ebikozesa mu marwariro ag'ahansi ni kimwe hari ebyo ebikanyiisa omuhendo gw'abashaho abarikukwatwa endwara ya COVID-19 mu Uganda barikugiiha omu barwaire abo bakujanjaba. Gavumenti n'obwera abegyerizeho n'agaayo gona okutaha emihingo y'okukingira okujanjara kw'endwara egi obwerikuta abantu omu keeshereko konka hariho omuntu orikusigara naayetengwa akiire koona ateesherekire kandi ogwo n'omushaho. Endwara ya COVID-19 ekabarukaho omwaka gw'2019 yatandikira omu ihanga erya China yija yajanjara omunsi yona kandi ahitira okugambira ebi yaherize kwita abantu abarikurenga omuri miliyoni 4.20. Omu Uganda yaherize kukwata abantu abarukuhika 9,526 kandi abantu 27 obariiremu n'abashaho yaherize kubita.
To the God of our salvation, to the Spirit who makes our lives new, come all nurses, to love and serve. We have been chosen.
Alice Ariganyira omuzarisa ahirwariro rya Kagote Health Center 3 omu district ya Kabarore nibagyegyekyerera ahambera mbi eri omu marwariro ag'ahansi eki arinda deewo orukukora na Bukuku Health Center 4 arikwikirizana nakyo. Nikigambwa ngu district ya Kabarore yaherize kutunga abashaho 10 abakwasirwe endwara ya COVID-19 omu weevu ya kabiri.
We only find ourselves without masks. Sometimes we use masks and they get finished. So that one leads to getting the infection. So we are requesting the government to supply enough masks, enough gloves to the facilities. Because you find we don't have even gloves at the facility, and yet you have to work on the patients, and they say you have to protect yourself by putting on gloves.
Because as I talk, myself, I contracted COVID. But if you ask around, I'm a person who rarely will see me without a mask if I'm not eating, and with the sanitizers you see. But I contracted COVID. So COVID is for every person, and it did not come for animals. So anytime you can contract a medicine. Health workers, being at the front line, we are always exposed.
Previously, we ran out of protective equipment, personal protective equipment, and that's why we contracted the disease, because we were serving the clients. So in the process of serving clients, that's when we got the disease, because we do not have personal protective equipment, so it was easy for us to get the disease.
Health workers give us, because they give up, because there is too much pain when what you go through during that process of getting COVID. There is a lot of pain in the chest, there is too much headache, and after, when you have come out of that sickness, you take 2 to 3 weeks without walking. The legs are so heavy and you feel a lot of pain. You can't walk on your own.
Wahika hirwariro rya Uganda Matters Hospital omu district y'Ibanda embeera neeyerariikiriza ahabwa kuferwa omushaho wafiire bwa nyuma y'okubura obujanjabi bukumara kandi ahi yayohererezibwe aha irwariro rya Mbarara Regional Referral Hospital embeera ekaba yaheza kushoba.
Kitalo nnyo mwegumi.
Bernard Muhwezi Kabambuza widowa nawe nayongera kushobora ahambera egi.
Because we akanyegambira tutakagira nambara ngu harumbuyo yabiri nazanjaba on private room 5 akana teka nobuyagira paka kanati na kino muto kugira ngo nateka kubona yihirwe akakoko.
As I wouldn't even say that she contracted it from the hospital, because it's difficult. I mean, we interact. We are not isolated only in the hospital. We move out of the hospital. You wouldn't. It's difficult to know where you contracted COVID from. It's quite difficult, as you know. You cannot see. the virus.
Abasirikare usanga mbabahe ibitabo abana abasirikare bako baferira umuntu aronke ibyo babahe babashashura fees mbakora shi bashira. So if government can bring up such programs in health intekatekante ni kibasa kutuyamba hita abantu babira affected munonga yaba ko umuntu akabagwira mu motoka toka basa kumageragera ndetse n'umuntu agira mbara akavuga nayo mutahi wayine corona akajya mutura
okufa kw'omukazi we tikirateganise we wenka konka kikateganisa n'emitwe y'abantu abari kumureba nko yine endwara ya COVID-19.
Tamani munonga hanyuma yo kufa hata nori bacyara buryo muwe nakaya kimanyire mu family yanjye twena turiki positive hata nyo ngagumuza muri treatment ndema isolation natural konka sebo nesa y'abantu mbandi mwenu stigma tinko basa naza kuzumuduka gure kintu ningambera nkaho mu distance ntankiwe nkakira nkirizanyire tarisha umuntu nawe sakukingeduka tarisha umuntu nawe sakukingeduka yagenda.
Irareri niryo ryonko mu district y'Ibanda aho bujanjabo bwa COVID-19 burukorwa bitabu embere rukushoba nibasindukwa Mbara Hospital. Emmanuel Byarhanga omzarsa ninga shiga gynecologist ahirareri nagirango abashaho ahirareri bakwasurwe ndwareji konkango eki tekibatinise kurugaha mu mugwabo obwo kukiza amagara g'umunya Uganda.
As I told you, the team, the COVID treatment team we have are people who have been trained and we're willing. It is very important. You don't force someone to go into the treating these patients. They have to be willing. So we do not have any staff who has given up or has resigned because of he or she doesn't want to treat COVID patients.
Dr. Agaba Francis orukukurirwa reri Bukuku Health Center 4 na jirango burichweka na rishi department ahirwa reri bakatunga mushaho wako wasurwendwara ya COVID-19. Dr. Elias Kumbakumba orukukurre byo kujemesa abana hirwa reri Mbara kandi omuhwezi worukukurra ebya COVID-19 abw'amatendekero n'amarwaro na jirango nabo bakatunga ekizibu nicyo kimwe.
Tuferigo mushaho wena urukurebera abana konka barwire already mu department yitu tubuye mama abantu kikuma bakwasibiki covid kandi bakugiha tutekateka ngwajihire mu gwabo mukora abo kuba abana twara mask kimwe icya kabiri basaba bino bumwire konka batakuboreka konka bakubukorora bakaninga bakubuturira so urebo umwana muragurure utakumanya ngo hino bumwire kuno bumwiba. So ncho tukirizo tukareka ngo buri mushaho we kureba umwana icyo kubanza just akwetasa kumucebera umaraka umaraka nyuma uko umuntu hakumira batamucebera just akwetasa uko kwikushaka kwashama waranzeyo ubundi yakorora akorora misho niba kuyine maski utunga ruski mpanga
then maternity my nurses my midwives tested positive many of them and actually it is disturbing us very much. You find one midwife works night, day. Even right now, I don't have a midwife to cover maternity. So the one who was resting is supposed to come back to cover the day duty, because of the infection among the health workers.
Ahirwa reri Ruhoko Health Center 4 district y'Ibanda nabembera neyera richeruza ahabwembera mbyeji erikwera richeruza hata abashaho nibashaba government kurugaye kakora cyona ecyari kubasa okureba ngo COVID-19 ati yamaraho amagara gabo.
Of course protective gears is challenge kuba nitwani tuchanga ngo mask ine kujivara umurundi gumo ikajinaga ngato shanga of course wabo ine nka 100 pieces turi abashaho 30 with the support staff tizikama level bishatu. So we are getting that challenge. Then we have also the challenge of course space koko wajireba space itu ninja. So na social distance we have very many because nitukora art clinics ngo n'abantu binyi muno.
We have been chosen.
Ebyo bikiriaho ahirwa Area Fort Portal Regional Hospital bono bagira ngu government etwire nebahereza ebikozesebwa ebirikumara okwerinda endwara egi. Aho tugambira ebi irwarire ribire ryatungira abarwire benashatu n'omwe aba COVID-19 ahari abo 255 basibwirwe 98 abo bitwa endwara egi kandi 27 bakiri aha bitanda.
Have adequate PPE. I can say last 2 weeks back we received a batch from NMS, and also we continue to receive from partners like Baylor and UNICEF. Within the course of the week or since the pandemic, we have been able to discharge 287 patients from that hospital. But as the cases tend to be reducing, we also realize that the number of deaths have been constant. On average, we are losing 1 person in the treatment unit. So we have a cumulative number of deaths at the treatment unit.
Agandi marwariro gakachinga COVID-19 eyo murundo gwo kubanza eyatahira mu ihanga omwaka oguhwira mu kwa kashatu ekaretera abe byamagara omu district ya Kabarore bachinga Nyakitoko Health Center 2 bwanyuma y'abashaho mukaga ahirwa reri kukwatwa COVID-19. Nobu Health Center yagarukiremo ekigura abarwire bakacendera
abarwaire kala hati nibakira kutina netutunga abarwaire bakendiro sikia ko kutwatunga kenyuma hata bakendiro haboko babandi nibatina kwitsa mwirwaro ngobateza kuhya abarwaire kandi to hano kirwaro nyana kubagumiza abasaho bona busaho bakwasira abarwaire kandi nabarwaire bakwitsa hano tukatungire even suspect or any case kugamba ngo umurwaire izere no bwoyi wakora.
Health Center 2G hona erione ekorwaho okuhinduka Health Center 3 kandi abatakane bagira ngo government echerirwe kutabyona ebikoresa ahirwa reri bwanyuma yo kushanga ngo nibija babura obuhereza obubarkwenda.
Health Center 2 has been overdue because it has taken a long time, almost 2 years. It's still under construction. We don't know as a community, we don't know what is happening. So we are requesting the leaders to come down and explain to the community why this construction has been overdue without being opened.
Kuboija obwire okatunga chance baro ne bakukora ijoro mukikura katero ahe kenombe beitu bakamusindika mu irwaro lya kliniki hata nkimanyisa ekyapa kiri kihandikireho Nyakitoko Health Center 3 beitu teine mirimo ya Health Center 3 teroho nebikwato bishobora kora Health Center 3 tebiroho so bali mukutubuzabuza itwe nkabayikaze banyakitoko tutukuroro burungi bwirwabe abukuba hata na hotara nagenda mu kliniki hati obukuru bwa Health Center 3 teburo
ekikozurwe omukurwanisa endwara egi nkaguma ha muhanda gwo kuyamba Uganda. President Yoweri Museveni akataha emihingo eyokukingira endwara egi okujanjara abashaho bombyaro ningashi ba village health teams nabo bakora cyango okureba ngo endwara egi tiyajanjara hamwe no kukoratereza abarwira bajine na munonga abo abakuragurwa omumaka gabo
ababo mu cyaro amwe okubanza zikaba zitakuboneka konka hatiya nizigumani ziza iyo twenda intervention ejo kureba ngo ntubafuho munonga na president cyere kwabiri nagamba no hora abaganga bomunonga abo kubantu garuka hansa community involvement omukurwanisa COVID-19 community involvement kimanyisa ngo hatiya alevo za district na handi konko omuntu mukuru no hansi
Tweba vesti turbanye kundire tuba volunteer chabaseze kora ahabwa magaraga batahi bitu na namagara bitu ahansi konka tukabe mutero muranga ngo government nayo twijuke ba VHT ahubwo bitwara nibinji hati aho biro bwizire hakugira cyaba uyiruka VHT bantu bakwe kandi wishice tetwara tuzayo twikati na masks zo kayo kora kushanga mu wire al positive injo tumudirectinga iburu bakama bitu bijaba bucebera kurunji bashanga babiri
then ikindi ba VHTs bari gukora umurimo gw'ama mu byaro akuba no bakuta information ati nureba nubaterana na hati nureba bamara kuntera ngo hina barwara abariyo ati nyine kohereza umushaho mu cyaro akuba tukwenda ngo kandi again tumareta hirwaro ati nonda kushanga urode nyina rwira family irimo abantu mwenda ati bona baba leta hirwaro reba so nushanga ngo vija bagwaza ki barwaza abandi
government katuyamba ahatereza masks kontanti kija zirinche no museru umutokoshanga ntumuhereza emwe ibiri zikazi rinje zirize mutumarira icyo nitweha yo kora twayigura masks zaitu na sanitizer muto twegura oyikira ko tinkabenisha ba government tuyamba reka tweza masks sanitizer reka tweza n'ibindi twatu bishime kwa tugenda nacyo
ahabwo kukoratara ebiragere byatirweho umuhendo gw'abantu bari kukwatwa endwara hati gucendire.
When we go to our communities, we have registered around 5 deaths happening in the community due to COVID-19, and many of the sub-counties, because we have 15 sub-counties, so we have registered quite a number of cases in these sub-counties, but most of them are under home-based care, as I've already mentioned, that we now have 62 active cases, and these are being followed up.
Ijuka ngo kwisya hebi byona tuyambirwa bwezi kurugwa mu kitongole cha One Ifra Women in News a Social Impact Reporting Initiative.
To the God of our salvation, I've been chosen by God, chosen to be nurses, to love and serve. We have been chosen.